Well, good afternoon, and welcome to A Gathering Place brought to you by the Gullah Geechee Chamber of Commerce and St. James Health and Wellness, because this is our fourth Wednesday Public Health Awareness episode. Every fourth Wednesday of the month, we bring you public health topics to help your physical, emotional, and mental health. And this month is May, Mental Health Awareness Month, and we have Dr. Lillian Lewis Debnam joining us to talk about mental health awareness, and of course, Ms. Linda Liner, Outreach Coordinator, to talk to us regarding special enrollment and the Affordable Care Act. And right after this opening, we're going to bring them in, and we'll get rolling with public health awareness brought to you by St. James Health and Wellness. We'll be back right after this.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question.
And we're back. Welcome back, everyone. Let's go ahead and jump right into our fourth Wednesday Public Health Awareness. And we welcome today Miss Linda Liner. Hello,
everyone.
How are you?
I am
good to
blessed.
see you today. Yeah,
Thank
good to
you.
see you today. We're going to talk about the Affordable Care Act, but before we do, let's go ahead and bring in Dr. Lillian Lewis Debnam. Dr. Debnam, how are you doing?
Hello. I'm doing good this afternoon. How about you?
We're doing wonderful. I'm doing wonderful. Linda, how you doing?
I am blessed and highly favored.
All right, very good. I have to say this. I love that background, Dr. Debnam.
Well, with it being Mental Health Awareness Month, I wanted to have some of the feng shui and yin yang to balance things out. So thank you.
Very good. Well, it is certainly beautiful and calming.
Yeah.
So it's getting the job done. Linda, we're going to bring you back right after we take a few minutes to talk about mental health awareness, so you can tell us more about what's happening with the Affordable Care Act special enrollment. So we'll see you in a few moments.
Sure.
Thank you. All right, so let me go ahead and bring this presentation up so we could go through this, Dr. Debnam. And to May is Mental Health Awareness Month. And before we came on the show, and we were just talking about what was going on, and just a little over a week ago, we had the tragedy, the massacre in Buffalo at the Tops grocery store, which was devastating in and of itself, has a act of violence towards innocent folks. And then yesterday in Texas at an elementary school, 18 elementary school children and 2 adults were slaughtered by an 18-year-old. As a matter of fact, I believe Buffalo, it was an 18-year-old also. In the Buffalo case, the perpetrator was taken alive, and in the Texas place, the perpetrator was killed. But it's those two events in and of themselves are traumatic for our country. I cannot imagine what the families are going through. On a personal level, every time I hear a mass shooting, even though I was not directly involved, I worked 3 blocks away from Mother Emanuel AME Church at the time. And I remember the morning, I remember hearing about it that night, and the position I was in, I dealt a lot with the natural disaster response. And this was a disaster. So you had to get into that response mode. So the next morning when we arrived, before we really let folks into the building, because they had not found Dylan Roof at that point, so no one knew where he was. The financial officer at the time, and I believe we always had a security, they went through the building looking for, at the time, no one knew it was Dylan Roof. They just knew that it was a young white male, not knowing where this person was. And just to know that we were 3 blocks away from where it happened, and that person could have been in the vicinity. I knew Senator Clementi Pinckney personally because of politics. I knew others indirectly because some of their relatives actually worked where I worked, or I just knew their relatives from politics and had worked with their relatives. So indirectly, a lot of people still are dealing with the trauma of what happened in Charleston. And every time you hear about a mass shooting such as those that we've experienced in the last week and a half, in some ways you relive it again. And I'm sure the families are just reliving the whole situation. And this creates a mental health issue.
Mm-hmm.
And this is specific mental health issues related to mass shootings and that trauma. But our country really, and speaking on a personal basis, mental health is I really am concerned for my country.
Me too.
Not just because of mass shootings, but we're still in a pandemic. COVID has not gone anywhere. We may not be wearing the mask, but I just came, I went to the grocery store and I wear the mask. And, I try to wear a mask. Or if I don't wear a mask, I'm usually outside and around people that I know who have been boosted. I personally have been boosted. But just the trauma from the pandemic, and we're still experiencing that trauma. The mass shootings, the economic concerns of folks.
Yeah.
All of this, we're just in stressful times as a country and as a global entity.
I feel like we each are experiencing our individual day-to-day stressors and day-to-day traumas. But like you said, there are so many things that our country is, and globally, is dealing with as a collective. And so there's this collective trauma and collective stress. And there's always kind of this energy right underneath of anxiety that I'm seeing across the board. You can see it in our littlest ones, our babies, our children. We're actually in the midst of a pediatric basically mental health crisis or emergency. And so even here in South Carolina at the state level, there's advocacy and action and groups coming together to say, well, what do we do? Because there's just very large increases in adolescents and little kids who have to come to emergency rooms for mental service supports. So I think we're like rehashing it. It's like PTSD.
Yeah.
Go ahead.
So what does that look like when you're telling me that our children, the pediatrics, our children are suffering from a mental health crisis? What does that look like when you're telling me our children are going into emergency rooms because they're in the midst of a mental health crisis? What does that look like for our children?
And I think folks who take care of kids, we're seeing it across the board. So to me, emergency room is like the last level. So I see it in clinic. I see a kid that tells me I'm stressed out. And I'm like, everyone always says, oh, well, you're a kid. What are you stressed out for? You don't have a job. You don't have to worry about paying bills. But they worry about COVID. They worry about getting sick. They worry about their friends getting sick. Or they worry about, well, what will someone think if I do or I don't wear a mask today? Will I be bullied? People died in this pandemic. People lost grandmothers, grandfathers, parents. We have orphans who don't have parents coming out of this pandemic. And so that's a stressor for kids. In our pediatric space, we often will call these sort of things adverse childhood experiences. But it looks like a parent going to jail because they tried to get food for you. And now I'm dealing with that trauma. I'm dealing with navigating foster care. I'm dealing with how do I get ready for this test and try to get out of high school and move on to whatever life looks like next when school has been virtual and I didn't have internet that worked well. So it comes in many forms, but mainly it's anxiety and depression, but even every now and then we're seeing, I want to kill myself. I don't want to be here anymore. And that's hard to hear from a 9-year-old or a 12-year-old or an
Mm-hmm.
18-year-old or a 50-year-old. So, yeah, it comes in many forms, but it's been heavy on my heart because I feel like we keep rehashing and dealing with the same thing again and again. Um, our kids shouldn't have to worry about going to school and getting shot. They're making bulletproof backpacks, and I'm like, a kid shouldn't have to wear anything bulletproof. So,
That's right. That in and of itself is traumatic to know that I have to wear a bulletproof backpack. That
right.
takes away your innocence.
W-
That takes away your safe space. You
As a
shouldn't have to
parent, how do you
worry.
have that conversation?
That's right. That's right. That creates even more trauma on top of just thinking it through and everything. How do you have that conversation? We have some slides here. You have some slides here, and I want to go ahead and get started with that. And I'm glad we opened this conversation talking about what happened yesterday in Texas and a week and a half ago at Buffalo. And my heart goes out with those communities. But what are resources that are available to us? What can we do on a personal level to help our mental health?
And I did pull some stats that I can just quickly rattle off because I think
Okay.
you and I are thinking about the fact that mental illness is all around us, but I think a lot of times people downplay it, and there's a lot of stigma related to mental illness or mental health. And so I just wanted to
Mm-hmm.
kind of throw some things out there for us. One
Please
in five
do.
adults experience mental illness each year, but only half of them get treatment. One in six children or youth are going to experience mental illness each year. Half of them are only going to get treatment. One in 10 young people are going to experience a mental illness after having COVID. So we're still in this pandemic. COVID's still happening. People are still getting infected. And there's long haul COVID, but there's also the stress that comes along with it. And so it's really been impacting youth and young adults. Um, like I mentioned about mental health emergencies, they've increased by 30% in our adolescents. Suicide has been increased by 30% since like the 90s. So over the last decades, not just now, it's prominent. And so anytime I present a problem, I want to also present some options for solutions. And
Mm-hmm.
so, over the next few slides, they're just a couple of resources. They're going to range from national resources to statewide resources in South Carolina, as well as some local resources in our Georgetown and neighboring counties. But on this slide here, I just highlighted some of the organizations that are national, but also here in our state. So NAMI, or the National Alliance on Mental Illness, um, is there's a South Carolina, I guess you could call it a chapter, as well as Mental Health America, and they have a chapter here in South Carolina. Mental Health America, I believe, is actually who came up with Mental Health Awareness Month being May back in the 40s. And then specific to South Carolina's, there's our Department of Mental Health. It's like associated, you could think of it like a public health agency. And there's also Federation of Families of South Carolina. So they really focus more on like parents and youth. But this little blue box you see to the right is just more about a huge support that the Department of Mental Health provides here in South Carolina. It's the Mobile Crisis Hotline.
Mm-hmm.
And so I, as a provider, can call it if I'm trying to find help for someone, but individuals can also call it, or families can call it. If you're in the middle of a crisis, someone is experiencing mental illness or mental emergency, 24/7, you can call, and there's somebody who can talk with you on the phone if need be. They can come to your house or your school or your clinic. Um, if they're worried about there being violence, they can contact public health services. They can, I mean, not public services like the police or fire department, whoever they might need to partner with. They can help you navigate that and create a safe space. And so on the next page or so, I highlight that number, but I tell my patients and parents, if you already have someone who's experiencing mental illness, go ahead and put that in your phone because there might be another episode and you don't want to be trying to figure out where it's at. go ahead and lock it in. Most of us have cell phones, and you can just put it on speed dial to access it this way. And so this slide actually is talking about some of our local resources in our county of Georgetown, but also Horry County. There's Access Family Services and Waccamaw Center for Mental Health. They're huge providers here in our area, and I know they're doing a lot of work. Dr. Smith over there is amazing with the kids, but there's only so much that these people can do, and so we're always looking for mental health professionals. And if someone is interested in going to school to do that, please, contact me so we can figure out how to get you with mentors and get you in those spaces. But I wanted to highlight them as sort of the key players in our community, as well as give that website, which you can go on there, South Carolina Mental Health Centers, find your county, and it'll show you pictures of the site. It'll show you the director of the site, the staff. You can get to learn about it, figure out their hours. Do they have outpatient services, inpatient services? So before it gets to the point again of that emergency, they can be a good resource.
So it's good to know that there are resources out there available to us, not just statewide or nationally, but I did not realize that there were local resources, because you hear so much, and it's true, but you hear so much about the cutbacks when it comes to mental health care. But to know that there's still some resources out there, as you say, that we could partake of before it becomes an emergency.
Mm-hmm. I always am looking at prevention. So if we see someone and we're worried about them, if we can touch base with those people in our community, and I hate to say they often do have a backlog like everybody else. Like you said, we're experiencing cutbacks, but they do good work and they do the best they can. So access early and often. So
All right.
here, go ahead.
No, I was going to say you can also text also.
Exactly, because I love to text. Calling's great, but texting's fun too. But here, just that
y'all young folks like to text.
I got love to text. But yeah, so you can. There's resources for calling, texting, and if you speak a different language, you can also get support. But you start off by calling the number, and it can help navigate to where who can best help you. There's another program called South Carolina Hopes, and they focus on mental health, but also like addiction support. Because when we think about mental health and the fact that only 50% of people are receiving treatment, it's not that people aren't trying to address the mental illness. They often will address it with addictions, with substances. And that just kind of, it starts a feedback loop. And so they go together, mental health, and if there's an addiction, that addiction support. So South Carolina Hopes kind of focuses on that a little bit more, but they also have a 24/7 line. And then I had to highlight my teenagers. So teens, we love to text, we love to use shorthand. They are ready for the shorthand. And it's also 24/7 at the teen line. Or
so we're texting teen line to 839-863.
Mm-hmm.
Text. Okay. We're going to show this, y'all, periodically throughout the show. So we're going to go beyond this slide, but we're going to put these up periodically throughout the show so you can remember that you do have access to resources. And so our next slide here, there's some more suicide prevention Lifeline, Veterans Crisis Line. So they have, I didn't think about this, but specific, I know it, but I didn't know it, that there's specific lines depending on your need.
Mm-hmm.
I see Veterans Crisis Line, LGBTQ plus Crisis Hotline. And then what is this one here? SAM, SAMHSA.
Substance Abuse Mental Health Services Administration. So again, they focus on if you're experiencing substance abuse and how you can access treatment. And so they help navigate that space. And all of these are 24/7 lines.
And as you said earlier, it becomes this loop effect because a lot of people are self-medicating. with alcohol, drugs, etc. And there are resources out here that can help you so that you don't self-medicate, that you actually take care, hopefully, of the underlying causes of your mental health crisis. All
Right.
right. This is very good. Very good.
We're in the middle of that opioid epidemic too, where
You know, glad you brought that up. Go ahead. Go ahead.
people are in
Continue.
pain. And that's physical pain, but it's also emotional pain. And so opioids were medicines that doctors gave you to treat those pains, and it kind of spun out of control. And so
Yeah.
I think people often, again, it goes back to that stigma. They say, well, I'll get my physical pain treated. So they don't talk about that emotional part. And I think you gotta check in on both. So
That's
different
right.
lines for different things, because you may want to talk about one issue more so than the other. But these groups are really good because they realize that it's interconnected, and they can move you between those spaces. And
Yes.
in just in terms of highlighting, like different groups have different issues at times. Veterans, PTSD, or homelessness. We have such a large homeless population among our
Hmm.
veterans, and LGBTQ and transgender. We talk about teenagers who are like figuring out who they are, and that can be a lonely space. And we know that there are higher rates of mental illness in those groups at certain times, and want to create safe spaces.
Yeah. Yeah. And two things that you pointed out, that one, I feel terrible that I forgot about the opioid crisis, because we've been dealing with the opioid crisis for years. Then COVID came along and we're focused on COVID, but the opioid crisis didn't go anyplace. As a matter of fact, because of COVID, it probably got worse because people became disconnected from sources that could help them. So now you're compounding the issue. And in the veterans crisis with homelessness, that is, a growing, it's been an issue and it's a growing issue, but it's also growing not only in veterans, but I'm imagining, just today I saw an article. They were talking about the renters are getting
Mhm.
slammed. People are getting slammed who own single family houses, because the housing market is just crazy. The sellers market, people, getting 20 bids for cash on one house, and
Right.
$100,000 over the value of the home. That in and of itself is a crisis, and it's a mental
Mhm.
health crisis too. But now renters are getting slammed because people are raising rates, and it's not, some of these folks, it's not like they don't have jobs, they simply can't afford housing. And
Right.
just imagine, how fortunate we are to have a roof over our heads. But just imagine someone like, I have a good job, but I can't afford to put a roof over my head.
It's a truly real issue. I hear about it all the time.
Yeah. And then you imagine the children, if you're a family and you have children and your children are watching your parents and they're picking up on those emotions and feelings, and children observe. You can tell children stuff all day long, but they watch what we do.
Hmm.
So we're just creating some issues here that I'm so glad that you came on, because it's making me stop and reconnect myself to what's going on, and really understanding we are in a real mental health crisis in this country.
We're on crisis on top of crisis on top of crisis. But I'm going to bring up a bright spot, I think.
Okay.
So my sister, she works in the school system, and she had a student who their family is homeless, in the sense that they're no longer in their home, and they're in hotels. And he actually is so excited because they're spending more time in a close space together, the student. And they've got more channels, I guess, on the TV than he had at his other house. And so kids, I think the
Are
important
resilient.
part, right, they're resilient. Adults are too, but they will find that smallest little thing and
Mm-hmm.
roll with it. And so, out of the mouth of babes comes the truth. And so we got to look at those bright spots. Um, but they
We
definitely
do.
tell it like it is.
We do. I'm so glad that you mentioned that. And that's the truth. And children will find those bright spots. So we have another slide here. And I notice now this time we have some Espanol numbers and information in Espanol. So tell me a little bit what this slide is about.
Mm-hmm. So some of it is some repeats of what we saw before in terms of like the suicide prevention line, but also giving the Spanish version of the number. And then on the left side where you'll see sort of the green words is
Mm-hmm.
that screener if you want to do it anonymously and just kind of look at, well, how am I feeling, let me touch base and center myself. And then there's also services for if you can't hear, so deaf services, because there's lots of different populations. Mental illness knows it doesn't discriminate, and so everybody's dealing with their own things, and so I wanted to make sure we had some resources for those different groups. And yes, I wanted to highlight our South Carolina to Apoyo. They've got a great team of ladies, but they're not 24/7. They've got a certain time period that they're there, and so from 9:30 to 8, that's the best time to be able to touch base with them.
All right, very good. So right now, while we're in our show, you can actually call right now. It's not quite 8 o'clock. So if you're suffering a mental health crisis or issue and you speak Spanish, there's an outlet for you also. There is a resource for you to call, and you will have a Spanish speaker who can help you during your need. So what else do we have?
Well, a lot of those are the ones we highlighted before. So yes, let's
Mhm.
go to this one because it's a
All
pediatrician.
right.
All about the kids, right? um, Adults matter, but children's mental health really matters. I'm trying to get
Mhm.
this bright young being to become a super amazing, healthy, and well adult. And so it takes a village. And there are, I mentioned the Federation of Families of South Carolina. There are supports for parents who are dealing with behavioral or emotional issues with children. It's also for teachers, but there's also a retreat coming up in June, in a few weekends or so. And if you're interested in going, they can help support you get in there. It should be fun and relaxing, but it also talk about navigating some of these challenges that we've been talking about, and so I wanted to include that there. And then, as you know, people of color, sometimes it's nice to be able to connect with someone who looks like you, because it's a different experience. So again, it's highlighting these different experiences people may have. But I came across this on, I'm not sure if it was a TikTok or Facebook, but I took it down, and every now and then I'll reach out to a different group. My favorite one is Therapy for Black Girls. I'm a Black girl, but I like to tell my patients and colleagues about that. There's therapy for Black men. There's therapy for people for Latinx, and then there's a clinicians of color group. And so you can go on those websites and look at all these different providers and read about what they concentrate on, and pick someone who you might feel connected with.
Very good. I did not know that there are so many websites, resources, in particular for the need for a Black or brown therapist. So this is a wonderful list. You hear about it, but to see a list, I need you to send me this list. I'll be happy to share it on our social media pages also. That's wonderful. So tell me about this retreat that's coming up June 11th through 12th. Where is it going to be?
It's going to be in Columbia,
Okay.
so kind of central in the state. It's 11 and 12. They have an agenda. I think it goes a full day the first day and maybe a half a day the next day. But parents as well as kids are able to attend. I think they're looking for children, preteen and teens, so above 12, because there's not like childcare for babies on site. Um,
Gotcha.
I want to say tickets were like $25 or so.
Oh,
But
that's
if
not
you
bad
got a
at
big
all.
group, then they can give you some assistance to be able to go. Or if you have to travel and you want lodging, I think there's also some specific assistance for that. So uh,
Okay.
I think it's a good opportunity coming up in just a few days.
All right, very good. Let's glad to hear that. All right, so we have slide number 8, infant formula shortage. Now you know, woo, this been
Everybody's
in
been
the
stressed out about
news.
this.
I mean, everybody. I've been seeing all the old school formulas on Facebook and TikTok. Y'all about to poison some people, but you know,
It's been
go ahead.
scary.
Tell me what
It's
we
been
need to know.
scary because
Mhm.
we make these advances, and so when we say better, we got to do better. But if we don't have, like, well, what do you do? And so I
What do
can't
you do?
blame people for trying some unorthodox methods or old school methods. The part that's scary for me as the pediatrician is that um, formula and breast milk is formulated exactly for that baby. Back then, it was like, okay, we know they're gonna need some sugar, we need some protein, but it wasn't specifically made for that age. And so
Mm-hmm.
we've got babies who've gotten sick because it's a little bit too much of water in that. And so they can't take in enough sodium, or they're getting diluted of their electrolytes, or it's a little bit too much of something. And so it's causing seizures. And so you have to be really, really careful with nutrition for a baby. And
Mm-hmm.
so, I mean, I hope everyone knows that they can reach out to their pediatrician, but they can even reach out to like your OBGYN, because a lot of times we have formula on site, or we are able to work with formula reps, or we may know this store got a shipment in this morning. So this is where we can go. We work closely with WIC. WIC has done, especially here in South Carolina, has done a great job of expanding access. So typically, what WIC stands for Women, Infant, and Children's Support. They give nutrition supports for mamas and babies.
Mm-hmm.
But typically they say, okay, you get this formula. Now they're saying you can potentially get 3 different options, because whatever is at the store, we want you to be able to get what's at that store that day. So they've been trying to be flexible. But there are other organizations that can help in terms of looking for formula, because they realize this is a huge problem and are trying to do whatever they can to support. So CAAs, or community action agencies, they're really neighborhoods that come together and say, what's happening in our community? How can we help? They've been looking for formula. They got lists of formula, so you can go to that site, find your local agency, and they can tell you where to go. And it changes from week to week, changes from day to day. So check in
Mm-hmm.
often. United Way, I know in our local community, it's Black River, but you can call or text 211, and it'll connect you with the United Way. And they also have been looking for formula. If
So they're doing some of the work for the mothers and
Right,
finding formula, and then you could reach out to these resources.
they're
Yeah.
trying to decrease that stress a little bit.
I know, right? Ooh, child. Ooh, child. Um,
And this little picture here is just the special formulas, because our babies on the special stuff, parents have been freaking out. There is a program that can get you, you have to ask your doctor, but if you have a special formula, they can do an urgent product request with some of the changes that the federal government has been working on, and it can get shipped directly to your house. And in
very good.
Gerber's got my Gerber baby experts. So they're 24/7. You can video chat. They've got all the different ways you can connect. So a mommy at home at 2 o'clock in the morning at her wits end, or daddy can connect with them, and they can support you too, even if you don't use Gerber products.
That's right. That's right. I was going to ask you a question. You kind of answered it with the 24/7 video chat. Before you go out and make your old school formula, you need to contact your pediatrician to make sure that formula is the recipe is balanced for your child, or even if it's a recipe you should even be using for your child, or
Right.
get the questions answered before you go get some formula that may do more harm than good. And I know you're panicking, parents. I know you don't want your children to suffer, but call your pediatrician first, or call 24/7 video chat with my Gerber, baby experts. I didn't know that. So that's a good thing. Call 211 for United Way. So many resources available to you during this stressful time. And it is a stressful time. On top of everything else. Oh Lord, what are we going to do? Yeah.
It's a crisis on crisis on crisis.
I know.
And we're going to be so awesome. So I
It's
think
going to be good.
community
People
has to come together and do our thing.
Yeah, we are resilient, but oh gosh, I don't know why we got to go through all this stuff and everything. But this is great information. I'm going to take this Dr. Dednam, especially this page. If you send me the Black and Brown Therapist, but this one I'm going to take and put on our pages, our social media pages for the Gullah Geechee Chamber of Commerce and the other social media pages that we have. And I think that's that last slide. But yeah, I'm so glad that you came on to talk about mental health awareness in May, because this is the month to raise awareness, and Lord knows we got a lot going on, as you say, compounding on top of each other. But there are resources out there to help us, folks. There are resources out there. You have a mobile crisis hotline, 833-364-2274. I'll be showing this the rest of the show also. Or you can text. You young folks like to text, so text home. Text home to 741-741 or text Teen Line to 839-863. Text Teen Line to 839-863. There are many sources for everyone out there. We just got to get the word out and make sure people know.
Because we might have a problem, but there is a solution. And I think working together, we don't have to reinvent the wheel. Somebody's out there knows an answer. Somebody out there can be a support in that moment. Sometimes you just need a hug. Sometimes you just need somebody to tell you to take a walk. It's all right. So reach out before it gets to those bad spaces.
And we have a local caring pediatrician and Dr. Dednam who came on and wanted to talk this and share her information. And I'm so glad that you did, and telling us the stuff that's going on in the state of South Carolina and local locations where we can get help. Because I hadn't even thought about it. But I'm so glad that you came on with that information. It's been great.
I'm glad you invited me out again.
I know you got to come back. I know we all been busy and everything. Tell your husband I said hello. We just really been busy and everything, and I know you guys have been busy taking care of yourself. So I'm glad to hear that also. Yeah. Anything else we need to know as you wish us a goodbye, and we'll bring on Linda. But anything else you want to drop? Some
other than green. It's mental health awareness color. So
green.
I know we only got a few more days in the month, but everybody wear your green.
But this is a good weekend going into this, because this is Memorial Day weekend and everybody's gonna be out there. We want everybody to be careful. Not only physically, but be careful mentally. Take care of yourself, folks. Exactly. Emotionally and mentally. And you got some resources out there. And if you drink too much, call. Because sometimes when you drink too much, you be, triggering some stuff. But now we got some phone numbers that we can call.
Take care of yourself and take care of others.
Very good. I love that. That's a good way to end it. You were waiting for that moment, weren't you?
It just came right then.
Well, you are good. You are good. Look, thank you for joining us. Really appreciate you joining us today. And we're going to bring you back now, always. And let it be sooner rather than later.
Anytime. Thank you, Marilyn. Take care.
Too.
Bye, everybody.
All right, everybody, let's bring our next guest on, Miss Linda Lina. Hey, Linda, how are you?
Hi, I'm blessed. And yourself?
I'm doing great. Thank you very much. And I am going to, we're going to talk. We got a lot going on with Affordable Care Act. Dr. Dednam came on and joined us and gave us some really good information about May Mental Health Awareness Month, and we needed to hear that stuff. But you got some stuff going on for us also with some new stuff for the Affordable Care Act. And so let's just go ahead and start. First of all, I want to know what's the alphabet ICHRA, and what does that mean, and what can you do for us?
Okay, that is considered as individual coverage health reimbursement arrangement. And the question has been asked, why now? And what it does is that it allows an expansion of income range for up to $1,100. and the special enrollment for anyone from 100% to 150% of the federal poverty level. They can go into the marketplace and apply for health insurance coverage.
All right, very good. So this is a new update to
Yes,
during the special enrollment. So this is going to allow more folks to be able to get on the Affordable Care Act.
that's correct, especially those people that are between the 100 and 150% of the poverty level. Then they
All right.
can now go in.
So where do I need to go to find out the poverty level, the actual income?
Okay, one of the places you can call me and I can let you know, or you can go online and just put in the federal poverty level for the special enrollment, and
Okay.
that will give you that information.
Okay. All right. Very good. Thank you. Very good. And I think you have some slides also that
Yes.
talk about that also. But you ready to go to the next slide?
Sure.
All right. All
Okay.
right. Individual coverage, health reimbursement arrangement. Why now?
Exactly.
All right. And how does it work? It's reimbursement of employees for insurance rather than buying it for them. Go ahead and explain that to us.
Sure. It's considered to be called EGRA, and it's based on reimbursing employees for insurance rather than buying it for them at a high level. So what happens is that employees can design their plan, including dividing which employees are eligible and establishing reimbursement limits. Employees purchase the individual plan they want, and then employees submit claims for reimbursement. Employers reimburse employees for valid claims. So basically, they can either go into the marketplace and get it, or they can get a private insurance coverage.
Okay. Now, is this coming from, there was a gap because of insurance provided by the employee, and they were finding that it created a gap because it was based on individual coverage, I believe, and your family could not get covered.
Right.
You could because of income levels, etc. Is this also part of addressing that gap?
Yes, it is.
All right.
And the
Very good. I'm glad to
about
hear.
it is that it allows you to include your family on the plan as well. And, that's a good thing too, because
Oh, it
sometimes
is.
Families aren't able to get full coverage for everyone, and they can either get it for themselves and maybe look at Medicaid for the children. And if they aren't eligible for the Medicaid, then they can look at CHIP, which is at a higher rate, and CHIP is Children Health Insurance Plans. And that's, one of the things that we can also assist with as well.
Okay, excellent. So, folks, you could get in touch with Linda, and she can help you get through the process for setting it up and getting enrolled through your employer. So, right here, the process for setting up an ICHRA. How do you pronounce it? ICHRA.
ICHRA.
Is that how you? ICHRA. Yeah. So the start date. This is during special enrollment, so you can pick a start date and then get into the design for your employees.
Right. What it does is it gives them a class for eligible employees. And then also it determines a budget and set allowance. It establishes legal plan documents and communicate your new benefits to employees and provide resources for employees to purchase individual health insurance. So that way the employer has information that can be passed on to the employee so they can understand how the plan works and what needs to be done in order for it to continue throughout the enrollment period.
So this is an excellent resource for small businesses.
Exactly, it is.
And small businesses who employ folks that can take some of this burden off of small businesses and providing health care and benefits to their employees. So that's wonderful.
Yes.
That's good news.
Yes.
All right. So during the special enrollment period, you give them, they have 60 days to buy a plan once the employers figure out what they're going to offer and go through the process. Then the employees have 60 days to enroll. Is that what I understand?
Yes, that's correct.
All right. So, and it sounds like it allows them to kind of maybe shop around and get the best price.
Right, for what they are looking for, because not everybody needs the same type of plan. It
Mm-hmm.
just depends on your situation, and
Mm-hmm.
that's basically what determines what you decide you want to do. Because in some cases, some people may want dental, or they may
Mm-hmm.
want vision, or they may
Mm-hmm.
want both, as well as the other coverage that's being provided.
Okay. All right. Very good. Very good. And then we have qualifications. Who
Right,
qualifies for an ACA plan?
right. Anyone between the age of 18 and 64 can purchase a plan. And who qualifies for a subsidy? That's household income, again, between 100% and going up to 1,100% of the federal poverty level. And also, they're not able to get affordable coverage through an employer. Theirs or their spouse plan. And they're not eligible for other coverage such as Medicaid, Medicare, vets, et cetera, excuse me. And if they are married, they file a joint tax return. And
Okay.
those would qualify them to be able to go and get that particular ACA plan.
All right. Very good. So 64, why to the age of 64? Is that where
Because,
Medicare can kick in?
right, after the age of 64, a lot of people can retire and get Medicaid. And in some cases, depending on how much their income is, they could also possibly qualify for Medicaid as well, which they consider to be a dual um,
Okay.
eligibility.
All
And as
right. All right.
you can see on the screen, it gives you the listing of the percentage, starting at 100% going up to 500%. And it
Mm-hmm.
depends on the family size, and that determines what where you are in the income range and whether you qualify.
Okay. Very good. So when they say you're 100%, so your family size, you're one person,
Right.
income. So when it says 100% of $13,590, what does that really mean? Does that mean you're making $13,590 and that means you're eligible?
Yes. The yearly income is
Okay.
at 13,000, and
Okay.
because it is, then you, as you said, you're eligible to be able to go in and get that special enrollment.
Okay. And then you would be 100% eligible.
Exactly.
Okay. All right.
Mhm.
Very good. I got that. So what else do we need to know?
The other thing that you need to know is that basically um, the health insurance marketplace is going to open back up again as of November 1st, and it
Mm-hmm.
goes to January of 2023. And then at
Mm-hmm.
that point is when the special enrollment becomes available again. Now, with the special enrollment, if you need assistance and it's free at no cost, then you can reach out to me, or you can go to getcovered.org, and there are a listing of other agencies, navigators, which myself, that you can reach out to that may be in your local area. And if you are wondering what is a navigator is through the health insurance marketplace, and we're either an individual or an organization that's trained and able to help consumers, small business, and their employer as they look for health coverage option through the marketplace, including completing eligibility and enrollment forms. And these individuals and organizations are required to be unbiased, and their services are free to consumers. So, with that, what it's saying is that we can't tell you who you should choose for your health plan. We just give you the options and the information so that you can make an informed decision. Say, for instance, if you have done the process, there is an issue, you need to appeal, we can guide you through with that as well. And also, we are here to be able to provide whatever necessary assistance that you need. Say you're hard of hearing, you're blind, you're handicapped, or you have a language deficit, then we can make sure that the language that you speak is available so that you can understand how the process works. Now,
Very good.
with the Navigator program, as I mentioned, we are statewide. We have approximately 16 navigators throughout the state of South Carolina. And our focus is on education, outreach, and direct enrollment assistance into the health insurance marketplace. And once again, we are free and we provide unbiased assistance. The way that you enroll is, as I mentioned previously, through open enrollment, which is November 1st, 2022 to January 15th, 2023. And also the special enrollment period, which you're eligible based on a qualifying life experience.
Mm-hmm.
So with that being said, with the special enrollment period, that occurs outside of open enrollment, and your qualifying life event in the past 60 days, which includes loss of coverage, changes in residence, changes in household, and other qualifying life events. And some of the other qualifying life events would be if, say, you were to move to a different zip code, or you move to a different state, if you get married, if you get divorced, if for some reason you have to have a change in your income, and that way you can come and see if you're eligible. If you have a situation where you've added a child to your family, either by birth or adoption, or you have lost a family member, then these are some of the ways by which you can become eligible to apply through the marketplace. But mostly make sure that you check to see if you don't have coverage at this time, to see if you are eligible, because as Dr. Danette mentioned, with mental health and getting treatment, unfortunately, you do have to have some form of insurance coverage. So the marketplace is available for those who are eligible to be able to get that coverage.
It's always good to hear that also. And if y'all need to reach out to Linda Lina for more information, her number is 843-826-3773. So reach out to Linda and she'll help you learn more about the Affordable Care Act, special enrollment, and of course the open enrollment period that comes up every November 1st. And then also she'll help you get an appointment at St. James Health and Wellness. Linda, it's always good to have you with us and always good to have you updating us on what's going on with the Affordable Care Act, also known as Obamacare, and just keeping us in the loop and keeping us informed. So I want to express my appreciation to you for that. And thank you. You make sure that you stay right on top of it. And as you said, you're part of a statewide network.
Yes, so, that's correct. And
so
also,
go ahead.
I apologize, Marilyn. If any organization, churches or sororities, fraternities would like for me to come and address a group as far as what the special enrollment is involving, or if a business needs help in getting their employees on some form of insurance, then I am available. And the best part is that you don't have to be our patient, and you don't have to live in my regional area for me to help you. I can help anyone across the state of South Carolina. So with that, if you need me, call me. And then we can talk.
That's right. Call Linda at 843-826-3773. Linda, thank you very much for joining us tonight. I'm going to bring Dr. Debnam back in to say her final goodbyes. We're going to all wave goodbye, and then we're going to get on out here because our hour is wrapping up here. Here she goes. And I just want to make sure, Dr. Debnam, that we say a final goodbye to you and thank you very much for joining us today. And Linda, has always, it's been great to bring you on and keep us up to date on the services provided by St. James Health and Wellness, and of course, the open and special enrollment of the Affordable Care Act. All right, so it's good to see everybody. Enjoy the rest of your day. Get out and enjoy that sunshine.
And thank you, Marilyn, for having us and all that you do for the community.
Oh, you're welcome.
We really appreciate you. Thank
you. You're a rock star.
Amen.
I appreciate that. And I appreciate you. All right, everybody. It's been great. And I will see you later. Have a good day.
Bye-bye, everybody. Stay safe.
Thank you. All right, everyone. So that's Dr. Debnam and Linda Liner joining us. And today, we pre-recorded the show. But, drop your questions and comments, and we'll take a look at it on Facebook. And we will not have a show this Sunday. Well, we will have a show, but it will be a repeat show this Sunday. I actually have a speaking engagement, and I'm really looking forward to this in Florence, South Carolina, and it's a women's empowerment program. I don't know if they want me to come talk about women's empowerment, but we sure going to do it Sunday. They might get more than they asked for. But everybody, thank you for joining us this evening. We appreciate it. Go forth and do good. And make sure you take care of your mental, emotional, and physical health, because that's why we have St. James Health and Wellness. We'll talk to you later.